So I'm going to touch on one of many programs that are in the college right now and talk to you about the pleasure that I have in working with the next generation that was alluded to earlier this morning, who has a keen interest on crafting their careers so that they have an opportunity to make a societal impact. And in this specific case, I'm looking to train these engineers and designers in a more general sense to collaborate with stakeholders to define problems. And specifically, I'm working in the health space. Within global health technology, we've honed in on medical devices as an opportunity to provide our students with project-based experiential learning opportunities. So our students are charged with designing medical devices for low and middle income country settings. In terms of curricular elements, I wanted to highlight what makes our program a little bit different than some of the others that have developed over the last 5 years. We're really focused on teaching the students a co-creative, user and context-centered design process. So our students are scoping projects through clinical immersion and experiential learning, and we're emphasizing the appreciation of the cultural influences on the engineering problem, in addition to the wide range of unique constraints that can be observed within the low and middle income country setting. And then adding in this community-based demonstration. So once we come up with a concept, we're going back to that community, testing it, and then iterating it with input from the community members. And through this process, our students really are exposed to opportunities to develop not only technical skills, but also intercultural and clinical competencies. So here's one of the programs within the Global Health Design Initiative that we offer, an academic program model. So here, this is a credit-bearing program. It has many components, but we start off by selecting a team of multidisciplinary students, and at Michigan, we're lucky because we can field a team with engineers, clinicians, nursing, business, economic, anthropology, art and design students. So really put together a unique combination of students. We select a theme. In many cases, we've been working in maternal health. We select partners. We have partnerships that have extended beyond 9 years at this point. And then we train the students up based on the theme. So if it's maternal health, they're completing readings and written assignments on obstetrics and gynecology. They're doing observations at our university hospital in OB-GYN before they're going to the clinical setting at the field site. They study the theme and then dive in. Typically 8+ weeks at the field site. They're in morning meetings, they're conducting observations with clinicians, interviews and focus group discussions. So we're really leveraging design ethnography techniques, and then they follow that on with 1 to 2 semesters of capstone design. We also offer paid internships, and in those opportunities, they can focus on one of these 4 areas. Wanted to introduce a few projects. The first is a blood salvage device that came out of Komfenochi Teaching Hospital in Ghana. This is a device to replace the soup ladle transfusion method, where literally a soup ladle is used to salvage a woman's blood during a ruptured ectopic pregnancy. Here the students were creating a purely mechanical device that could be easily maintained in that setting, that wasn't as complicated as the electromechanical devices that were rendered useless after a part was no longer viable. Another extreme project here would be something that is a tool that was designed to facilitate a safe adult male circumcision in a traditional setting. So for those members of the Ugandan communities that practiced traditional adult male circumcision that would not go to a clinical setting, this was a tool that could help to increase the likelihood of safe outcomes. And at the bottom, a subcutaneous contraceptive insertion device to help deliver contraception by health extension workers. Many of these projects are continuing. The first one is a startup company. The second one received funding from the Gates Foundation, and we continue to work on the development of that project. And the bottom one has received funding from Saving Lives at Birth Canada. Here is a list of a handful of the more than 65 projects we've worked on over the last 9 years, more than 300 students involved. we've had the opportunity to partner with NGOs and with multinational medical device companies. And those partnerships have been extremely valuable, not only to our students, but I think to our partners, and I'll highlight that as well. What's not shown here include road traffic safety, accidents, physical medicine and rehabilitation, and water access themes. And then I'll just end on the last slide by pointing out again, Paul mentioned the business model development and where there are opportunities for potential collaboration and partnership. I want to just say a couple more things about these design project opportunities. From the student learning standpoint, being able to have that access to the institutional know-how that was mentioned earlier today from NGOs and industry leaders is essential. It gives them a chance to develop skills that will make them more viable in the marketplace, as well as give them a leg up to get the jobs and work for the kind of companies that they want to work for. As a faculty member, being able to engage with industry partners and NGOs who have expertise that is well outside of the academic realm allows me to tweak the curriculum to help craft a generation of students that are going to be the most effective employees as possible moving forward. From the partner standpoint, in addition to getting access to talent, the other interesting element here is that these students are able to generate complementary information and data that companies and NGOs otherwise may not be able to access. People interact with students in a very different way than they do employees and NGOs. And when you have students that are spending 8+ weeks on the ground collecting that information, needs statements, defining problems through user requirements and engineering specifications, developing 20+ concepts for any particular problem, there's a lot of wealth knowledge there. And lastly, professional development, the opportunity to work to develop curricular content for employees of industry in terms of emerging areas like design ethnography, as well as research. Thank you.
Thank you.